My name is Aaron Werner, and I'm an optometrist here and recent owner of the practice. The practice was started by Dad over 35 years ago, and I'm actually a fifth-generation optometrist, so did everything I could not to be here, and here I am. But it's in the blood, and I love it. Practice sees altogether about 250 comprehensive eye exams a month. So I think the AdaptEX will change how we talk about AMD and AMD outcomes. We don't do a good enough job saving the first eye on patients, and we do a fantastic job saving the second eye. It's not a sexy disease, so I don't think it gets the attention that it deserves, but we definitely need to focus on how we are treating this disease. And I would not be surprised if dark eye optometry becomes standard of care in the disease process. Similar to how having an OCT or an ultra-wide field is kind of become standard of care of how we treat retinal diseases. And I think Vision Source is primed to take the lead in the diagnosis and management of AMD. As an organization, we've got the infrastructure for the education. We are incredibly forward-thinking in medical optometry. Not only are we used to technology, but we love technology. We're on the forefront of research. We've got Vision Source people in leading the way, really in all aspects of the profession. But we need to reduce the costs to the healthcare system, and treating AMD early, saving vision, and treating it with nutraceuticals instead of having expensive injections, and the cost to patients and employers of missed work and whatnot. This is really a no-brainer, and Vision Source is exactly where we need to be to take the lead on this disease. The AdaptEX for us has really given us the missing piece of the diagnosis. Prior to the AdaptEX, we were able to identify risk factors. We're able to identify the red flags. Well, the AdaptEX now gives me a diagnosis ahead of time where the risk factors still come into play, but they help drive the need to do the dark eye optometry with the AdaptEX and further the testing, as opposed to just monitoring the risk factors over time and waiting until it gets bad. We need to do a much better job taking care of the disease earlier in the process. And now that we have the AdaptEX to do that, I think this is really going to change the entire way that we approach and treat the early diagnosis of AMD.